Roudnitsky, who's our trauma medical director. I thank you all for coming on Facebook Live for our September Surgical Symposium. And today we're going to feature Kings County's Trauma Center. You might ask, what's a trauma center? So you may be aware that different hospitals are specialized in different things. Like, for instance, Memorial Sloan Kettering is known as a cancer center, and that's something that they specialize and take care of. Well, here at King's and several other hospitals in the city of New York and throughout the country are trauma centers. And people typically don't think about trauma because it's something that we don't plan for. Trauma is essentially anything that can cause injury. So this might be a motor vehicle incident, accident, or a gunshot wound. Assault, falls are big. Anything that can cause injury, whether minor or severe, ideally would go to a trauma center in most ideal situations. In New York City, we're very lucky in that we have a lot of hospitals that are designated as trauma centers. At last count, we probably have 16 hospitals in New York City that identify as trauma centers. In Brooklyn alone, we have 5 of those centers. Now, the way the designation, what makes a place a trauma center? Well, typically in most states, the state will designate a trauma center, but there has to be some type of verification process. And over the last couple of decades, the American College of Surgeons, which is the body that both Dr. Roudnitsky and I belong to, sets a certain amount of standards that hospitals have to meet in order to be designated and verified as a trauma center. And in the state of New York, around 2014, the state government gave up their tools as becoming designators and decided that they would have the American College come in to help with the verification process. The state still designates the trauma center, but only after the American College says they're a trauma center. So you might ask, well, what's a trauma center? Well, a trauma center must have the ability to take care of injured patients. And there are different levels of trauma centers. A level 1 trauma center, which is what Kings County is able to take care of any injury, any multi-injury, any severely injured person, and any type of the organ system, orthopedic, like for broken bones, fractures or such, thoracic, abdominal, pelvic injuries, head injuries, neuro that might be handled by neurosurgeons. Anything you can name would be handled by a level 1 trauma center. So typically, it's a center that is a referral for other hospitals to send patients if they're severely injured, and those hospitals can't take care of other of those injuries. Now, I want to just spend a second. There are level 1, level 2, and the difference between a level 1 and level 2 are mostly in terms of community outreach and education and so forth. Level 2s may just concentrate only on taking care of a patient who's injured, whereas a level 1 trauma center like Kings County, we do outreach in the community in terms of putting the word out there of who we are, trying to do programs in terms of preventive type medicine. For instance, we may have drives sort of as passing out helmets for those who are on bikes for children, or maybe car seats is another type of program that we might indulge in. In addition to, we have a very strong commitment to education, not only of the community in regards to trauma, but also into surgical residents, medical students, and other advanced practitioners and so forth who might be interested in taking care of the injured patient. And one last thing I'll say is that Kings County is part of New York City's Health and Hospitals Corporation, which is the largest municipal hospital system in the United States. And New York City alone, within HHC, New York Health and Hospitals, we actually have 6 trauma centers. 5 of those are level 1, and 1 of those is a level 2 center. So we are a very substantial part of the trauma system of New York City. If you get injured in any of the four boroughs of Queens, Brooklyn, Manhattan, or the Bronx, there's a very good chance that you might end up at an NYC HAC trauma center. With that little introduction, I'd like to turn it over to Dr. Roudnitsky, my trauma medical director, and he can provide some more information on what Kings County Trauma Center is all about.
Thank you, Dr. Stone, for excellent introduction. I will more talk and will be concentrating describing Kings County Hospital as a trauma center. So here in Kings County, approximately 5-6 years ago, we adopted concept of acute care surgery, which is incorporating highly specialized group of surgeons who taking care of trauma patients, surgical critical ill patients in surgical ICU, and as well emergent general surgery patients. Those surgeons are all fellowship trained. They all have additional certification and board certification of trauma and critical care in surgery, and those surgeons are available 24/7, 365 days a year, with expected response time to any trauma or critically ill patient in 15 minutes from activation. We are level 1 trauma center, and specifically in regard of trauma patients, as Dr. Stone explained, we able and capable to take high level of care of any type of trauma, any severity of trauma of injured patient. We are accredited by American College of Surgery and verified by American College of Surgery as level 1 trauma center. And as Dr. Stone already mentioned, we meet criteria of the volume to be level 1 center. We meet criteria of the research and publication as level 1 center. And as well, we meet all criteria for outreach and prevention of trauma. We are seeing approximately 16 to 1800 patients a year through the emergency room, and we admitting about 1200 patients a year. Specifics of Kings County and the central Brooklyn or Flatbush area that we're serving, we have relatively high level or high percentage of the penetrating trauma, which is around average 20% throughout the year. In summertime, penetrating trauma may come up to 20-30% of patient of total volume.
Just for our audience, what's penetrating? What do we define as penetrating trauma?
Penetrating trauma, when we're talking about, we're meaning two type of trauma. Mostly, it's a stab wounds and gunshot wound, which is of course result of the violence. So our trauma division, it's a part of our general surgery department, which is Dr. Stone in charge. Our trauma division has 5 full-time job surgeons, 2 part-time surgeons. Again, they all board certified in general surgery, and they all board certified in trauma and surgical critical care. One more time, we have 24/7, 365 days a year trauma surgeon in-house, which is always available to take care of injured patient or critically ill patient in ICU. In terms of the ICU, we probably have the largest ICU, surgical ICU in borough of Brooklyn. We have 20 beds of surgical ICU, and the surgical ICU where we provide again 24/7, 365 days a year care for trauma patients. We have all range of possible and required surgical subspecialties available to take care of trauma or any other critical or seriously ill patient. As I mentioned, again, it's surgical ICU doctors. It's a wide range of orthopedic surgeons, general ortho surgeons, and subspecialty surgeons. We have 2 orthopedic traumatologist, which is dedicated to take care of patients with severe musculoskeletal trauma. We have Department of Neurosurgery, which provide full range of care for severe traumatic brain injury patients. We have Department of Oral Surgery, which is take care of all possible fractures of face. We have ENT department, which is helping us with taking care of patients with ENT type of injuries. We have pediatric surgeons to take care of pediatric trauma. What is unique for Kings County and only available in Kings County in borough of Brooklyn, we have oculoplastic service as a part of ophthalmology department. Our oculoplastic surgeons perform complex surgery for injury of the eyes, and we do accept transfer from all trauma centers in Brooklyn to Kings County. All patients with oculoplastic injury, again, we are only the one trauma center in borough of Brooklyn who is capable to provide this type of care for injured patients.
How you say we're the only one? How old are we, Dr. Roudnitsky, as a center?
As a trauma center, probably before I was born.
Are we? Is it correct that we're the oldest center in Brooklyn?
We are the oldest. We are the first one and oldest trauma center in borough of Kings, which is today Brooklyn, and I think we continue to be that tradition, historical tradition, to lead care of trauma centers in borough of Brooklyn. We'll repeat one more time that we are part of the network of H&H Health and Hospitals Corporation in New York City. We tightly connected to each other, and if any type of the patient requiring some type of super resources that are available in other trauma center, we communicate to each other, we share with each other, and if there's need, occasionally we may transfer patient for another institution for appropriate care. I have to say that it's a requirement of the college, which we fully meet this requirement. Our care of our patients and outcome, it's completely depends on the quality of care, and we're tracking our quality of care. We have very thorough quality department, quality process in our trauma division. There's a high standard set up by American College of Surgery. We have trauma program manager, which is fully dedicated only for trauma patients. We have quality coordinator, which is fully dedicated for trauma patients. We have injury prevention coordinator, an outreach coordinator who is reaching community centers and different community organizations to coordinate our efforts to prevent traumatism, which is one of the leading causes of death, especially in the young age, mid-age population. To have thorough quality process, you must to have database, and we have dedicated trauma database. We have dedicated registers to maintain high quality database, and this database is leading our quality process, because only by assessing and reassessing your outcomes and benchmarking with outside other trauma centers, you can know and understand where you are and how to change your approach for the patient to improve outcomes. We do participate as a trauma center in national data collection center, and that what is allowing us to benchmark Kings County as level 1 trauma center against another 600 hospitals which is participating in the TQIP, which is Trauma Quality Improvement Project of American College of Surgery.
It also, right, about we've talked about using the data as not only as a quality measure, but it also provides for putting out new um, information in regards to research and so forth. So
Absolutely.
Has been really instrumental in getting our registry data, contributing to papers that are literally in the world's literature on trauma.
I agree with Dr. Stone. No data, no research, no quality. But again, we have all of these components. Um, our publications, it's not just coming from our trauma department or trauma division. Other departments and division which is participating in the care of trauma patient, they are highly active in terms of the research and publications. And I have to stress out um, leading departments in this care. It's of course our emergency room colleagues and department. This is our orthopedics college and colleagues and all other subspecialties. Um,
In
as a
addition, probably to the care. So just us being a trauma center as well just doesn't mean this guys like Dr. Roudnitsky and myself who are surgeons, the emergency department, anesthesia, the OR, everything centered around the fact that they know we're a trauma center. So they have to work, we all have to work together in order to take care of these injured patients. So it's beyond the Department of Surgery, even though this is a surgical symposium.
um, I would cite probably um, statement from Top Knife book. It's probably the most popular trauma book
Written by whom?
in the world.
Written by whom?
Published in 10 or 12 different languages, and one of the two authors of this book is Dr. Asher Hirschberg, who actually wrote this book together with Dr. Maddox, who was one of the leading trauma surgeons in the United States. I would cite Dr. Hirschberg again to make efforts of trauma surgeon in success to save life and have good outcomes for trauma or severely injured patient. You must to have appropriate envelope of support. There's nothing we can do by ourselves if we don't have appropriate support from emergency department doctors, from nursing, from ICU, from operating room, from our nurses, from anesthesiologists, from ICU nurses, ICU team, our subspecialties, our rehab, which I did mention before, but of course for any injured patient, rehab is a critical part. It's from the time patient, walk into the hospital to the time patient leaving the hospital. We must to have multiple services, subspecialties taking care of patients. Only then it will provide our good outcomes and patient satisfaction.
This is likely why not everyone wants to be a trauma center. And just by the way, Dr. Hirschberg is still a member of our team today. If you don't believe Dr. Roudnitsky, you can ask him to cite that quote personally.
Yes, again, amazing surgeon, amazing writer, absolutely outstanding book. I would like to everyone, even non-trauma surgeons, just like it's interesting to read it. It's not classic book. It's special book. Would like to add another thing that as a trauma center in Borough of Brooklyn and New York City, we are active member and we participating in our REMAC committee, which is regional trauma advisory committee. We do participate in the state level in our STAC committee, which is State Trauma Advisory Committee. That's allowing us to understand where we are. New York City wide as a trauma center. We're always ready to help other trauma centers, other hospitals which is out of our network.
and maybe other diseases, right? So, when you want to talk briefly about, I think that it's really, we can't put this out in the midst of a pandemic without mentioning COVID. Uh, just maybe Dr. Roudnitsky, you could talk a little bit. You mentioned several times that the surgeons that are in your call rotation are double boarded, not only in general surgery, but also surgical critical care medicine. What role did Kings, what role did your guys play in terms of the pandemic and taking care of COVID patients who really didn't have any trauma at all?
Um, it it was not easy time at the moment of the peak of pandemic, um, but our trauma division and our surgical critical care surgeons were converted for critical care doctors. At the time of pandemic, our surgical ICU was serving as a COVID ICU for 20 critical sick COVID patients as well. Addition to our surgical ICU, our trauma surgeons were covering at the same time our ad hoc and new ICUs, which is in total with our surgical ICU beds at the time of COVID. Our surgeon was covering 24/7 for around 60 intubated sick patients. When parallel to us, our MICU colleagues were covering for probably even more patient around in the hospital in other critical care areas. Right now, thankfully for vaccination, the COVID pandemic is down. Currently, our critical care doctor surgeons don't have to take care of COVID patients. Hopefully, we will not have need
Hopefully we'll not have that again.
to go
but-
again for that route, but we prepared
But
to do this if there's
yeah,
need.
I wanted to just bring it out because it underscores the importance of trauma centers just in taking care of severely injured patients, but importance to the community and the resources that they may provide in other disasters, literally catastrophes. And as New York City's been through a great many of them, 9/11, Hurricane Sandy, and now COVID pandemic. Each of those crises, trauma centers have played, and Kings have played a crucial role in taking care of the city, and will continue to do so. Because we're a trauma center, we have this special skill set, these special resources, and so forth that are important to maintain, not just for the severely injured, but also, as Dr. Roudnitsky pointed out, for those who are critically ill from other causes, i.e., COVID 19. Ready for questions now? Or
Yes.
I think we're ready for questions. If there aren't any. Any
Sounds like
questions
no
in the studio
questions.
audience?
I think we briefly mentioned American College of Surgery divide all trauma centers for 4 categories: level 1, 2, 3, and 4. When level 1 is the highest level of designated accredited trauma center, and level 4 is the lowest one. In New York City, we have only level 1 and level 2 trauma centers. There's no level 3 and level 4 trauma centers. As Dr. Stone mentioned briefly at the beginning, difference between level 2 and level 2 trauma centers is the volume requirement. When level 1 trauma center is higher volume than level 2. Criticality of injured patients is another requirement for level 1 trauma center. You have to take care of certain amount of severely injured patient or multi-system injured patient. Publications and research is another requirement of the college, which is differentiate between level 1 and level 2 trauma center. Level 2 trauma center, there is no requirements for research and publication. Level One trauma center is obligated to publish 10 to 20 articles for 3 years period related to trauma. And as I mentioned before, it's not publications which done by a trauma department or trauma division. Other departments in the hospital have to participate in this. And as I mentioned before, our ED colleagues, our orthopedic colleagues, our other subspecialties is actively participating in research and publications, and we do meet all of these requirements of the American College of Surgery to be a level 1 trauma center. College come to us every 3 years for re-verification and make sure that we're maintaining high standards of college requirements. Of course, maybe unfortunately, our re-verification in 2020 was postponed because of COVID pandemic, and it's just upcoming right now, and we're fully prepared for it.
What is the frequency for ACS certification?
It's every 3 years.
What are the top wounds and injuries treated by the trauma care team at New York City Health Hospitals, Kings County?
We're capable to take care of any types of injury, any types of wound, any severity of injuries, because we have all, as I mentioned before, possible resources that we need. We have full range of critical care services and sub-services. We have all surgical subspecialties. We have emergency room physicians and nurses, orthopedic surgeons, neurosurgeons. So we are accepting and treating all patients, all type of injuries, all severities of injuries, all ages.
What plans do you have for pediatric trauma?
Currently, we do take care of pediatric patients. We are not designated or dedicated pediatric trauma center yet. We already hired pediatric surgeons. We're hiring another team members, which is requirement by college, and soon, maybe by the end of this year, maybe at the beginning of next year, we will be submitting our request for state to be our dedicated pediatric trauma center.
So we just as Dr. Roudnitsky said, we've really hired on one of the most important things of having a pediatric trauma center is having a contingent of pediatric surgeons. And so we have we'll have 4 by the end of this year once credentialing is done. I'll take this opportunity to put the word out there to Facebook community. One of the rate limiting steps in us applying for pediatric trauma designation is basically we're looking now for a trauma program manager, pediatric trauma program manager, for those nurses and physician assistants who are interested and you want to be part of a great team here at King's. We have an ad out as we speak, and so please do apply. Reach out to us if you're interested in that role.
How can I learn about trauma care services available at the hospital?
It's available on internet and intranet. It's available on Kings County and HHC internet. There's also information available in SUNY Downstate Surgical Department internet. If any questions about trauma services, you're welcome to call trauma office. Our number is 718-245-4686. We always will be happy to take call.
Can you just repeat that number for the audience?
718-245-4686. If trauma surgeon is not immediately available to respond for call, because of course we can be busy with trauma, we always will take your call and we will return call as soon as possible. I think if no more questions,
Yeah.
we will be wrapping up.
We'll wrap up here, and we much
this
prefer to
meeting.
give information this way rather than finding out first time when you come in. So,
Again, those who will have questions afterwards, of course, please feel free to call numbers. One more time, 718-245-4686, Trauma Office. Thank you, everyone.
thank you,
For
everyone.
attention.
Be safe.